If you do have early disease,
Hmm.
not advanced disease, but early disease, is a normal cleaning of the oral hygienist enough?
Absolutely. If you have that early stage of gingivitis, um, and you clean the cause off, which is the soft plaque and the early calcified bacteria, and your measurements are not that deep, just cleaning the teeth, just removing the bacterial layer will solve the problem. But it's like a garden. You weed it this week, it doesn't even have to rain. But if you look again next week, guess what? It's all green again. And those are in your mouth, it's the same. So as soon as you clean the teeth, it colonizes with pioneer bacteria. And as the bacteria gets time to mature, it changes from a predominantly what we call a good flora, a good biofilm, to a bad biofilm. And it's time related.
Mm.
The other thing is not everybody has bad bugs. Some of us have only good bugs and we'll never get the problem. And we're also not genetically susceptible. But other patients, the colonies of bacteria they house are bad. And especially in those patients, they need to go often. So yes, gingivitis can be treated easily and quite inexpensively as well, I might add. It will take you some visits, 2 visits a year to keep it under wraps. And if you listen on how you are taught to clean your teeth and you do that, you should be fine. But if you have the more harmful parts, then it becomes a different story. Yeah.
Just practically, you just said you were taught how to clean your teeth. So you brush twice a day. How many times a week must people floss? Every day?
Oh goodness, am I on the record here?
Yeah. No, I mean,
Yeah.
is once a week enough? Is every day a definite? And I mean, the problem is, again, it's not always nice, so people don't always do it.
Correct. And it's time consuming.
Yeah.
I mean, in theory, you need to clean your teeth. You need to brush twice a day and you need to floss your teeth every day. If you're not a very susceptible patient, you can probably get away with not brushing your teeth every day. But I must say, it's obviously a feel-good factor as well. It's how the day starts with a fresh mouth. The flossing is an interesting one. The Americans had a campaign that's had a big billboard that said "Floss or die." I mean,
Go home.
So I don't think we're quite there yet. But yes, when you floss, there's also. Listen, let me break it down into the brushing. So what's very important with gum infections is that it doesn't help if you brush your teeth. You need to be brushing the tooth and the groove that surrounds the tooth. It's the link between the tooth and the gum. So if you're not brushing your gums, you're going to develop a gum problem. So it's that little groove where you have your nail and your flesh coming together. You have that around your teeth as well. So when you brush, your brush must encompass that groove, which is crucial. That's where the bacteria builds up, where it gets in, where it causes the gum to detach from the tooth. So important, not a scrubbing motion linear in one line, okay? A little circular motion. And you must basically massage that groove. That's what it boils down to. If you can't, if you don't have the dexterity to do that, you must invest in an electric toothbrush. But again, it's an electric toothbrush that must be used as an electric tooth and gum brush. So crucially, very important, that groove needs to be brushed. And if you floss, and if you just go through with floss between your teeth, yes, you're going to prevent tooth decay, but you're not going to prevent gum infection. So very importantly, you need to pass that floss through around the tooth, against the tooth, and you must go with the floss in that sulcus to floss it. So yes, that becomes time consuming. And if you do that and you find blood on your floss, the biggest thing that patients say, "Doc, I'm glad you're here today. I've been brushing my teeth. It bled, so you'll be happy to know I stopped brushing it." That's the worst thing you can do. The bleeding is your body's way of telling you, listen, there's an issue. I want more cleaning. And if it doesn't sort it out by cleaning more and better and deeper yourself, it's your body's way of telling you you need help. You need to go and see somebody professional. So there's also the stigma where the patient comes in and say, "Doc, my gums have receded. My dentist have told me that I'm brushing my gums away." Then you look in the patient's mouth and you've got thick bacteria over the teeth. Why? Because the patient was told not to brush there. then you will develop a problem. So yes, you must brush those areas, but carefully and correctly.